Dear friends, at the outset, I'd like to thank Professor Mark Desmet and IOIs for giving me the opportunity to present on this very important topic, which is long COVID and post-vaccine uveitis. What are the risks and therapy? Now that we are into the second year of the pandemic, hopefully we will be able to come out of this very soon. But during these 2 years, it has left a lot of us to think about, a lot of us to probably deal with it in long term. And nothing probably the worse than what is called as long COVID syndrome. And does it affect the eye? How does it involve the eye? What are the ocular sequelae of this long COVID? What are the possible theories related to it? We'll be probably going through it in next few slides. We'll also pay a little bit of attention to what is the specific immune privilege of the eye in context of long COVID and as well as in the context of COVID-19 vaccines. And as we lot of more and more number of people are receiving COVID-19 vaccines, we also want to understand what is the impact of these COVID-19 vaccines in terms of uveitis or in terms of its inflammation, which it can cause in the ocular and the orbital region. So going to the first topic for this presentation is about the long COVID-19. It encompasses a wide range of symptoms which can occur even after 12 weeks after the infection, as proposed by the NICE guidelines. Cannot be explained by any other cause, and that is where it is a diagnosis of exclusion in the patients who had had COVID infection before. There can be 1 to 2% of the people in their 20s who had this virus who developed long COVID, as per the King's College London data, and compared with the 5% of the people in their 60s who will develop this long COVID syndrome. Now, this is in the context of the entire body, but when we speak about the eye as such, how does long COVID can affect the eye? It has been shown the reports causing the corneal nerve fiber layer loss and increased dendritic cells in patients with long COVID syndrome, particularly in the patient who have neurological symptoms also associated with that. What are the sequelae it can cause? It can cause clinical features of PAM. It can cause features like CRVO. It can also result into rhino-orbital cerebromucormycosis, and we have seen a rapid surge of this in India during the time May-June 2021. It can also present with central retinal artery occlusion with blepharitis, features of serpiginous choroiditis, papillophlebitis, and neurogenic ptosis, some of which has been published by my colleague authors in India in Indian Journal of Ophthalmology. What are the possible pathogenesis? So there are key proteomics things which are involved from the virus itself, which can interact with the ACE2 receptors on the mucosal surface, and this is the mechanism being proposed. And because ACE2 receptor can be present on the cornea and the limbus, though there is low levels on the conjunctiva, then it can also work through TMPRSS2 as the portal for cell entry. Now, this is just a simple diagrammatic representation about how the virus can probably enter and cause this. Now, switching gear back to our basic immunology, I'm not going to go into details of it, but eye as a spatial immune organ associated with anterior chamber associated immune deviation. And whenever there is an ocular antigen presenting cells, it generates the NKT cells, and then there is a splenic processor in the cell production, and also production of CD4, CD8, regulatory T cells and regulatory B cells, and also results into antigen-specific immune deviation, which is a very specific, unique phenomenon associated with the eye. And eye is also associated with the delayed type hypersensitivity. So this is probably in the context of why the COVID virus can cause this thing, and just trying to kind of stitch these two theories together about the COVID and the acute which can be seen in the eye. Now, when it comes to the COVID-19 vaccines, in last 1 year or so, there has been rapid surge in different forms of vaccines. So particularly, there are 5 different types of vaccines which are available: mRNA vaccine, virus vector vaccines, inactivated virus vaccine, protein subunit vaccines, virus-like particle vaccines. And this is again just a diagrammatic representation of how these different viruses or different vaccines are represented, either in the form of nucleic acid or protein subunit, or the whole virus, whether activated or attenuated, and the viral vector associated with the vaccines. Now, just to give you a kind of a brief overview about the different possible adverse events reported associated with the COVID-19 vaccine, and there is no cause-effect relationship has been established. It is just an observational data from different authors, and particularly from our group. We did report it about some of the cases, but the cases which are reported in the literature are overall Bell's palsy, central venous sinus thrombosis, acute anterior uveitis, corneal graft rejection, anterior scleritis, pan-uveitis, post-uveitis, and then there are single cases of multiple other things which have been reported. But this is as of September 2021. I am sure by the time you are hearing presentation, you would have seen many more cases in the literature. However, point to note that this kind of symptoms are not only associated with the COVID-19 vaccine. It has been reported by in previous vaccines also. So what does it mean? It is not a unique phenomenon associated with COVID-19 vaccine, so nothing to get scared for. There are different triggers also in the vaccine which can result into this, which can be a reaction to adjuvants, there can be molecular mimicry, or there can be delayed hypersensitivity. So what is the paradigm shift in our thought process, in our understanding is vaccine do not cause the disease in the recipient. It is known to cause immune related reaction, but it does not cause the disease in the recipient. It does cause immune response by the related to the vaccine, and the people are probably genetically susceptible to get key clinical features which they get post COVID vaccine, and this is how probably we should take it up. Thank you very much for your patient listening. I'm sure there are lots of questions, but I can just present some of these key features in the 7-minute talk. Thank you very much. Enjoy iOS. Thank you.